Thank you, Robert, for that very great introduction. And I'm told that your inaugural speech is, in one way, a bit like your obituary. People look at it when you're gone, but you have to have lived up to it at your valedictory speech. That's, I think, all our members represented here will understand that. I'm very pleased to represent the Honourable Rose Jackson, Minister for Mental Health. I'd also like to acknowledge the traditional owners of the land, the Gadigal people of the Eora Nation that we're standing on here today, and also the Aboriginal people that we represent in our electorates, and our commitment to closing the gap, particularly in mental health services and outcomes for Aboriginal people. Hello to all my parliamentary colleagues, too many to name individually, but thank you for being here and supporting the men's table. Thank you to Robert and to David Poynton, who we will hear from later, and also the wider team and other distinguished guests. So we're here today to raise awareness of the men's table. The men's table is a registered charity providing opportunities for men to meet and talk about issues in their personal lives in a non-judgmental environment. It's structured around groups of 8 to 12 men, known as tables, who meet once a month for a meal, and most tables meet in private rooms in pubs or restaurants with the cost of meals paid by those attending. The first table began in 2011, and more than 200 have been launched to date across Australia, including over 2,300 men. I know that in my electorate there are tables in Mogo, Churros, Narooma, Bermagui and Bega. And the charity's vision is healthy men, healthy masculinities, healthy communities. It aims to help men to build meaningful male friendships and connection by creating safe spaces to share, overcoming the stigma that men don't talk. They do talk, but they need to talk about the important things in life, things beside work, sport and hobbies. This event will launch the Charity Strengthening Community with Care 2024 report. The report highlights evidence showing that when men support each other in a safe and caring community, there are substantive benefits to their well-being as well as to their families and communities. The launch coincides with International Men's Day, today the 19th of November 2024. Now, as Robert mentioned, I've spoken in Parliament about my personal and family experience of mental ill health. And like all MPs, we all advocate for improved mental health services in our communities. The 2020-2021 National Study of Mental Health and Wellbeing found 43% of males aged 16 to 85 having a mental health disorder at some point in their lifetime. 22% of males report having an anxiety disorder and 27% report substance abuse. In 2023, there were 933 suspected deaths by suicide in New South Wales. 78% of these, 730, were men. The suicide rate among Aboriginal men in New South Wales is more than twice the rate of non-Aboriginal men. Known risk factors for suicide include a personal history of self-harm, a relationship breakdown or separation, legal issues, and one bit of advice: don't trivialise the midlife crisis. That can be a cry for help. The New South Wales mental health initiatives for men include the New South Wales men's mental health framework, which guides health service and policy. The framework provides guidance on how stakeholders can work together to support and achieve optimal health and wellbeing outcomes in men and boys in New South Wales. It highlights the key issues for men's health and the 4 priority areas of mental health and wellbeing: cancer, healthy living and chronic disease, and sexually transmitted infections. The Mental Health Forum was held on the 5th of August this year in this building and brought together mental health and suicide prevention sector stakeholders to develop ideas and solutions that will drive down suicide rates among men. Just 2 weeks ago, I spoke on behalf of the Minister at a South Asian Suicide Prevention Forum at Western Sydney University in Parramatta. There has been an allocation of $400,000 in 2024 to 2025, which will support grassroots initiatives with grants of up to $50,000 each to deliver targeted men's mental health and suicide prevention programs. The tender and a report outlining key recommendations and actions to improve men's mental health and suicide prevention will be released soon. Suicide prevention legislation aimed at making all government portfolios responsible for suicide prevention in New South Wales is in development and will be introduced to New South Wales Parliament in mid-2025. As part of the 2024-2025 state budget, $30.4 million over 4 years is being invested to boost community mental health services, with an additional 35 senior mental health clinicians added to existing teams across key areas in New South Wales. Also, $38.9 million over 4 years has been allocated to establish a new mental health single front door, making it easier for people to get advice, assessment and help by calling a single phone number, Health Direct 1800 022 222. The New South Wales Government has also provided $6.5 million over 4 years to Lifeline as part of its election commitment to support expansion of its text and web chat services for New South Wales residents. This is in addition to other grants. In total, over 2024-2025, New South Wales Health is providing $13.9 million in funding to Lifeline. Now, in conclusion, and in anticipation of David Poynton's keynote address, I'd like to reference how Men's Table fits into the changing interpretation of human distress as mental illness, and understanding that these symptoms may be a result of a social disease rather than mental illness. We need, as a government, to look at the social determinants that lead to feelings of anxiety and depression. It's through examining education, housing, employment, transport and physical health that we can make changes. The Men's Table is a great example of reducing isolation and improving communication to relieve the distress of men in our electorates. I'll hand over to David.